What the control trial looked at is how to really control that early onset diarrhea within the first 2 cycles of treatment. It was looking at standing doses of loperamide versus loperamide plus budesonide versus loperamide plus cholesterol. And then there were 2 additional arms, which was cholesterol with as needed loperamide and also now a dose escalation. Those first 3 subgroups have already completed their data collection. 2 of them, 100% of data has been analyzed. The other one, almost 100% has been analyzed. And there's a significant improvement in the grade 3 diarrhea across all of those groups. I've had a significant amount of experience with these because I not only did the trial, but I also treat several patients with neratinib in the adjuvant setting. And I have experience with just standing doses of loperamide alone. Those patients, I have not had a patient have to come off of treatment, but they do experience more diarrhea than the other arms. Budesonide with the standing doses of loperamide is very well tolerated. However, budesonide can cause a little bit more sugar issues and hypertension. So that was something that I had to monitor in the patients that were receiving that. And then cholesterol. I've also used cholesterol. And while it works wonderful for the diarrhea, it actually does cause quite a bit of constipation. So patients try to find which way they would rather go. Most actually prefer diarrhea over extreme constipation. So that was a little bit of a dance to try to figure out how to do that, but none of the patients came off of treatment. They were willing to work with it, but we did require some dose reductions of the cholesterol or of the loperamide. But most recently, I am doing the dose escalation, and I'm finding great success. My patients are able to get up to full dose and are not requiring any delays in treatment or any dose reductions. So when I do this, what I'm typically doing is I'm starting the patients off on 160 milligrams, which is 4 tablets, and I do it with as needed loperamide. And they do that for the first 14 days of treatment. And then after 14 days, if they're tolerating it without diarrhea, I go ahead and add an additional tablet to get them up to 200 milligrams. And if they tolerate that over the course of the next week to 2 weeks, depending on their tolerance, then we go ahead and get them up to the full dose of 240 milligrams. And I've had quite a bit of success with this.